Hi guys, good morning. This is latest update of Lunas Masahe. Okay, so I'm just going to explain that about lymphatic drainage. Okay, because there's a lot of lymphatic services going on all over the place. That especially for post-op, they use what is this? They drain fluid by using by opening the incision and pushing the fluid away, like externally, what is this, externally draining it. Okay, so like what I'm trying to say is they reopen the wound, and they are going to push that fluid out. So that is not the lymphatic drainage, guys. Okay, that is not, again, I'm gonna repeat, that is not lymphatic drainage. I don't know what kind of practice it is. That is not lymphatic drainage at all. That is actually inviting infection. Okay, that's inviting infection. Now the wound, you're supposed to leave it alone. Okay, you need to let it heal. So do not disturb it. You know, and then lymphatic drainage really is you are going to drain the fluid internally. That is the purpose of lymph nodes. Okay, so as you can see here, so this is the one of the school close training that is the best school, one of the best school. I went to school there for manual lymphatic drainage, and also finished my certified lymphatic therapy course at Norton Lymphatic School. So I have the model here. Lymph nodes, this green stuff right here, lymph nodes. Okay, cervical, above the belly button, the face area, drain here. No, not not above belly button, sorry, above the collarbone, I mean. And above the belly button and below the collarbone goes to the armpit. Okay, that is the pathway of the lymph. Now below the belly button and the legs and goes here. Okay, the inguinal. So your therapist will stimulate those lymph nodes there, and then that is the direction of the lymph fluid. So that is the purpose of your lymph nodes. Okay, so it's not that the therapist will reopen the hole, dig in with the toothpick or sharp thing and reopen and push that fluid away. Please, do not do that. I don't know who started that, but that is wrong. Okay, that is wrong. Professional lymphatic therapists do not agree with that practice. So please, if your therapist do that, run to the nearest exit, because that is wrong. And you might think that it will like decongest, and you might think that that is the right way because you can really see the fluid out. But believe me, when you recover, after a few years, you will see fibrosis areas. Okay, because fibrotic areas. Okay, that's what I'm talking about. So I see it all the time. A lot of clients came to me, and I see and I feel. Okay, so please don't do it. Now, if you ask me, well, what about those people that are in the clinic, even nurses do it, that they will like they stick a needle and then they will drain the fluid. Now that is different. Okay, that is different. That is nurses or clinics or surgeon clinics do that if you develop seroma. Seroma is very superficial, and it's a fluid that is just like right there beneath the skin, and the nurse and only what is this, a person that is certified, or like nurses or have enough training to do it. Okay, there should have no massage therapist will do it. Nurse can do it. No, surgeon office can do it. Your surgeon can do it. Doctors can do it. Do not trust with massage therapist. Massage therapist is not that is beyond her scope. I don't do it. I'm a massage therapist. I don't do it. Okay. Now, so they stick the needle to the area where has seroma and then drain it externally. That is okay, because that is okay. No, that is when the person or when the client develops seroma, then that's okay. Okay. Now, how do you develop seroma? Seroma, it can happen. Okay. You know that in tummy tuck, they have this drainage that your surgeon attached the drainage inside, or like after the surgery, right? That is to prevent developing seroma, right? To drain. Okay. Now, and that is also the reason why do you wear compression, because you have that drainage and you wear compression, help compress, right? So that is to prevent seroma. That's why if you have the surgery, you always need to wear compression, okay, to avoid seroma. And also it really helps you to give you the and comfort, right? Support. Now, and also contouring, and just to decongest, just makes sense. Like, yeah, just it's nonsense. Like, okay, why am I wearing compression? Oh, duh, because you just had a surgery and you want to compress the swelling, right? So lymphatic drainage, compression, and that those are two things that go together. Now, what is this? I'm forgetting what I'm saying. I have so much things to say because I see this a lot in Instagram. People, like ladies, like pushing fluid out, and I feel like, oh my God, please don't, please stop, please stop. You're hurting the client, and the client is like, I have few clients comes here, is like, I cannot take manual lymphatic drainage. I hurt so much. Like, what do you mean it hurt so much? It feels good. A lot of my clients just go sleep, so that's why they come here most of the time to relax. And it's like, no one is screaming in my studio when I do it. So it does not hurt, trust me. Now, so to avoid seroma, how to avoid seroma? Wear your compression, and do not take the drainage away too early. Okay, don't do it because you can develop seroma. So those are my advice. Make sure that your the attached drainage that your surgeon attached to your hips, make sure it's less than 25 for 3 days or more. Okay, and less than 30, that's okay, but less than 25 for 3 days or 4 days is the safest, I would say. And don't stop wearing your compression. Please don't stop. Okay, it's very important. So now again, this video is that for like the seroma, how seroma happen, and then what is the relationship of seroma and the one that's pushing the fluid out. So that is different when the nurse stick a needle there and push the fluid out, drain the fluid externally. Now that is different versus to the somebody's reopen the wound and kind of like really pushing really hard and pushing that out. That is different. Okay, now do not do that. That is not lymphatic. I don't know what kind of quack practice is that. Stop it. Don't do it. Okay, have mercy on your body, please. Consult to the professional, please. Again, this is Chris from Lunas Masahe, lymphatic specialist. Thank you for watching, and God bless.